Hi all, welcome to another video of NS Pharma. In today's video, we will see Pharmacist previous year question paper along with their answers. This is a part 2 section of MP Vyapam group 5 group question paper. If you didn't watch part 1, you can check the description box for the link. So we will see the first question of this video. We already covered 5 questions in the previous part. The 6th question, Schedule H drug refers. Schedule H drug refers. Option 1, to be sold by retail on the prescription of a registered medical practitioner only. Option 2, over the counter drug. Option 3, not for human use. Option 4, to be sold by retail without the prescription of a registered medical practitioner. The question is from the jurisprudence. Schedule H means, Schedule H drug means. The correct answer for this question is option 1, to be sold by retail on the prescription of a registered medical practitioner only. We can dispense the drugs, the Schedule H drugs, only for the prescription of a registered medical practitioner. We will see in detail each schedule coming under Drug and Cosmetic Acts. First one, Schedule A. Schedule A means they are the application forms. A for application forms. So they are the application form. They are different forms. Option B, Schedule B refers to rate of the fee when we are doing test or analysis. That is rates of fee. The first one option, Schedule A for application forms, or Schedule B rate of fees. Schedule C, as you know, this is the list of biological and special products. They are injectable. This one you had noted on. They are list of biological and special products, but they are injectables. Sera, vaccines, etc. coming under this category. Schedule C1. This is also list of biological and special products, but they are not injectable. They are nonparenterall. They are nonparenterall. Example, digitalis. Example is digitalis. Sometime in questions, the question will come like this. Vaccines is coming under schedule. They will give the options. You have to opt for Schedule C. So if it is digitalis, you have to opt for C1. So what is the main difference between C and C1? C is list of biological and special product. C1 is also list of biological and special product, but C is injectable drugs. C1 is they are non-parenteral products. Hope you understood this one, the difference between C and C1. A and B I already told. A is application form, B for rate of fee. The next one, D. D is list of drugs that are exempted from the provision of import. They are the drugs that are exempted from the provisions of import. That is D. D for exempted from the provision of import. When you are studying these things, you have to compare different categories if the same similarity is there. So this Schedule D and Schedule K have some similarities. You can see here, Schedule K refers to list of drugs that are exempted from the certain provisions regarding the manufacture. Because K is coming near to M. You know that M represents GMP. GMP means good manufacturing practice. That is GMP requirements. So that is related to manufacturing. So K is nearby M. So that means they are the list of drugs that are exempted from the certain provisions regarding manufacture. They are list of drugs that are exempted from the provisions of manufacture, while Schedule D refers to same thing, list of drugs that are exempted from the provision of import. This is import, that one is manufacture, because that is coming near to M. So up to D is okay. E for poison. So list E1 is the list of poison substance under the Ayurveda, Siddha and Unani system. Schedule F, next Schedule F, this is also important. They are provisions applicable to blood bank. They are related with blood bank. F represent blood bank provisions. Now F1 is special provision applicable to biological and special products. F1 and C1 is, there is a similarity. C represent biological and special product, they are injectable. C1 same thing, but it is non-parenteral. But what is F1? F1 is provisions applicable to this drug, that is biological and special product, as like C1 and C and C1 include biological and special product. Provision coming under biological and special products is F1. Hope you understood this, the difference between C1 and F1. There is a similarity. The F1 is provisions for the C and C1. Provisions applicable to C and C1 drug. C represents injectable, biological and special products. C1 represent non-parenteral, that is not injectable, non-parenteral, biological and special product. So up to F1 is okay. Now going to F2, they are standards for surgical dressing. F3 is standards for umbilical tap. FF is ophthalmic preparation. Ophthalmic preparation. Now Schedule G is list of substance required to be used under medical supervision. Schedule H, this was a question that we have to give the list of drugs which should be sold by a retail only on the prescription of registered medical practitioner. That is Schedule H. Schedule G and Schedule H, it's you have to differentiate. Schedule G is to be used under medical supervision, list of substance to be used under medical supervision. Schedule H, list of substance that should be sold under prescription of RMP. So when we are checking the medicine name, you can see in the back side of that box Schedule H drug, Schedule G drug, which category it is coming. So up to Schedule H is okay. Now we are moving to Schedule J. Schedule J means they are the diseases and ailment that drug should not claim to cure. Examples are cancer, AIDS, cataract, diabetes. They are the list of diseases that drug should not claim to cure. The drug should not claim to cure that disease. That is the Schedule J, list of diseases. Schedule K, we already talked regarding the provisions. Drugs are list of drugs that are exempted from the provisions of manufacture. Schedule M, GMP of the factory, requirement for manufacturing precise. Then Schedule M, same thing, but it is for homeopathic medicines. GMP requirement for homeopathic medicine. Schedule M was GMP for allopathic medicine. Schedule M2 for same thing, GMP of cosmetic. Schedule M3 is GMP of medical device. M1, M2, M3. M for GMP for allopathic medicine. Then requirement for manufacturing premises, GMP requirement of factory premises, plants and equipments. M1 for homeopathic medicine, M2 for cosmetic, M3 for medical devices. Then Schedule N represent the list of equipment to run a pharmacy, minimum number of equipments, that is the list of equipment to run a pharmacy. N O for disinfectant fluid, standards for disinfectant fluids. Once you study this one, you can understand, even if you are seeing this option, you can easily identify which is the schedule. So you have to study this one once. After that, if you see that options, you can readily identify which schedule is coming under this one. So schedule N for list of equipment to run a pharmacy. Schedule O represent they are the standards for disinfectant fluids. Now we are moving to the next one, schedule P. P for period, that is life period, that is expiry of drugs. Life period. Schedule Q. Q for coal tar colors that are permitted in cosmetics. They are the coal tar color. They are permitted to be used in cosmetics. Now schedule R represent the R, rubber, that is standards for mechanical contraceptives. Standards for mechanical contraceptives. R1 for standard for medical device. IS for standard for cosmetics. Now here one thing you had to see, R1 and ES. Here standards for medical device and standard for cosmetic, R1 and S. But when we are here in GMP of medical device is M3 and GMP of cosmetic is M2. Here you can see R1 represents standard for medical device, S represents standard for cosmetics. When you are studying, you have to compare this one, R1, S, M2, M3. These things, when you are comparing, you can easily get the difference. Now we are moving to schedule T. Schedule T means GMP of Ayurveda, Siddha, Unani drugs. So this schedule T you have to compare with GM, schedule G, schedule M. So schedule T is GMP for Ayurveda, Siddha, Unani drug. But schedule M, GMP requirement for allopathic medicines, plants and equipments. M1 for homeopathic medicine, M2 for cosmetic, M3 for medical device. So here R1 standard for medical device, S for standards of cosmetic. Yes, cos. You can see here, yes, cosmetics. Schedule T of GMP for Ayurveda, Siddha and Unani. And schedule U for they are the manufacturing and analytical records of drug. Manufacturing and analytical records, they are the records of drug. Manufacturing records, analytical records. When we are preparing in manufacturing and drugs, there will be records. You should keep some records for that drug. That is coming under schedule U. So next schedule U1, they are the manufacturing and analytical records, same like schedule U, but it is for cosmetics. So schedule U was for the drugs, manufacturing and analytical records of drugs. U1 for manufacturing and analytical records of cosmetics. Schedule V for patent, standards for patent or proprietary medicines, standard for patent medicine, V. W for they are the list of drugs marketed under generic names. They are the drugs. It should be marketed under the generic names only, schedule W. This is also one important point, normally coming under the exam, for the exam. So next one, schedule X. As all of the pharmacists know this thing, schedule X is a narcotic and psychotropic substance, list of narcotic drugs and psychotropic substance. Sometimes the question will come, opium is coming under which schedule? So you have to opt for schedule X. Here the examples are opium, morphine. The last one, schedule Y. Y represent clinical trials, requirement and guidelines on clinical trials, schedule Y. So these are the main these are the schedules coming under Drug and Cosmetic Act. This is very important. So if you are studying these all things, definitely in the question paper there will be one question. Normally in all the pharmacy question paper, one question, minimum of one question is there in for regarding this schedule, from the schedule of Drug and Cosmetic Act. So you have to by heart this one. but when you are studying, compare with the similarity between the two schedules. Suppose in case of I already covered these points, schedule U and U1 right now. In the last we studied this one, then M2, M3, then R1 and S. All these things, there are similarities, so you have to by heart this one. You have to study very well, because there will be one question, minimum of one question in the question paper. So we are moving to the next question, question number 7. Which of the following isomer is more potent as a muscarinic agonist? That is muscarinic agonist, cholinergic drug. Which of the following isomer, they are asking for the isomer, is a more potent as a muscarinic agonist? Options are trans isomer, cis isomer, R isomer, S isomer. Compared to cis, R and S isomer, trans isomers are more potent as a muscarinic agonist. Next question, question number 8. What is the lifespan of the platelet? The platelets that is present in our blood. What is the lifespan of platelets? Options are 1 to 2 days, 7 to 10 days, 1 month, 45 days. The correct answer is 7 to 10 days, almost 1 week. 7 to 10 days, that is the lifespan of platelets. So we will see the others. Lifespan of RBC. RBC lifespan is 120 days. 120 days. Lifespan of RBC is 120 days. That's why the doctors or medical department is saying you can give the blood, you can donate the blood after 4 months. You can donate the blood after 4 months. That is 120 days. That is the lifespan of RBC. Next one, the WBC lifespan. WBC white blood cells lifespan is around 12 to 20 days. It's about 12 to 20 days. The question number 9. As per the sieving method, that is sieving method, size separation, sieving method, the powder is passed through a set of sieve which are arranged in. So in the sieving method, different sieves are arranged. In which order? The question was, in sieving method, the powder is passed through a set of sieves which are arranged in dash. Option, a random order. Option 2, ascending order. Option 3, descending order. Option 4, any place. Random order, ascending order means from the lowest mesh size to higher mesh size. Descending order means highest mesh size to mesh size to lower mesh size. Then any place. The correct answer is descending order. That is from the highest mesh size, which sieve have got large pore, that will be in the top. Which sieve has got smallest pore, that will be on the lowest part of the sieving pan. So here we can see the picture. The first top of them have larger mesh size. In the picture itself, you can see that one difference. When we are coming into the lowest part, the mesh size will be very fine. So this is the sieving method. These are the descending order. Sieves are arranged. Question number 10. What is the incubation period of pneumonic plaque? The question is based on pneumonic plaque. The incubation period of pneumonic plaque. They didn't ask for incubation period of plaque, or they are asked specially for pneumonic plaque. So we have to answer for the same question. That is, options are 4 to 7 days, 1 to 3 days, 7 to 10 days, 2 to 10 hours. The correct answer is 1 to 3 days. If the question is pneumonic plaque, you have to opt for 1 to 3 days. What is the incubation period? I hope you know, but anyway, if anyone didn't know this one, incubation period is the period between the exposure to an infection and the appearance of the first symptom. Sometimes the causative agent of a disease will come under the body, but it will not show any symptoms in the body at that time. It will show after some time. That period is known as incubation period, the period between exposure to infection and the appearance of the first symptom is known as incubation period. So incubation period of pneumonic plague is 1 to 3 days. That one was the question. The other one, incubation period of bubonic plague is 2 to 6 days. Since the question was if it is a question is bubonic plague, you have to opt for 2 to 6 days, but if it is the pneumonic plague, 1 to 3 days. Hope you understood these all things. If you have any query, you can ask in the comment section, and if you like this video, please subscribe the button and please subscribe the channel and also press the bell button. Thank you guys. Thank you.